is Shweta Kumar and I'm a practicing physician. So in today's video, I would want to mention about certain health checks for women which you shouldn't miss on. So these are the additional screening tests or additional investigations which are done apart from your blood test. So first and foremost, I would like to mention about your thyroid gland. Now thyroid is an organ which is present in this area of your neck. It produces certain hormones which is very important for the vital functioning of your body. So it's very important that particularly if you have any thyroid issue, hyperthyroidism, or it is hypothyroidism, or any related activity, or if you have history of thyroid cancers in your family or any kind of swelling, it is important that you get it checked. So initially blood test is done, but remember, blood test might not always give a good picture, or it might not pick up if there is anything wrong with the thyroid. So it is important that you get an ultrasound of the neck done, ultrasound of this area, so which will tell about thyroid. It will show if there is any swelling, it will pick up. So if you see any kind of swelling in this area, particularly if the swelling moves when you swallow, so any swelling, please meet your doctor and do not ignore it, because thyroid cancers are really common and we do see it. And the most saddening part is the swelling had been present for a long time, and one would keep thinking that it is because of certain infections. So please make it a point, do not miss any swelling in this area. Second is coming to the second organ, which is breast. Now I don't have to emphasize that breast cancer is something which we see so often, and to the same extent we know that diagnosing it is not that difficult. Picking up a breast cancer might not be that difficult. So doing breast, so coming to the point, what should you do for your breast screening? So first is self breast examination is very important. So learn about it, check with your doctor how to do a good breast examination. Do it normally as well, so that you understand what is the normal structure, and when there is a swelling or some abnormality, you will be able to pick it up. So check with your doctor how to do a self breast examination. Second is, usually in less than 40 years, ultrasound for bilateral breast plus axilla. Axilla is the underarm area. So an ultrasound should be done which checks all these four sides, and this is very important. Second is, after 40s, generally mammogram is done. Mammogram is also an imaging technique. Now what happens, if the breast is very dense, the mammogram might not give a very good picture. So your doctor might advise you to get an ultrasound, and if there is a suspicion that any swelling is seen or any suspicious findings are there, then it might be further investigated, maybe an MRI, or there are various other tests, but you shouldn't miss on your screening of your breast. Now the third part which I would like to emphasize is cervical cancer. Again, that's not uncommon, you keep hearing about it. There are many vaccines suggested nowadays, but I would suggest please get your pap smear done. Pap smear is a smear which is taken from your cervical region, which is in the uterus, the external part of the uterus. Cervix, so cervix is the area, and there is a area around that from where the smear is taken. Generally an expert, a gynec, or a medical nurse would do it for you. So pap smear gives us a smear is created and studies are done, it is read by a pathologist, and that gives us a report where we see if there are any cells, if there is any signs, or if there is a cervical cancer. So this is also one of the test which is done. Nowadays we prefer doing it as a pap smear with HPV culture. Sometimes they might not take a smear, and instead they would like to take a kind of a biopsy from there, and these are all very safe procedures, very simple procedures. So meet your gynec, and the gynec will tell you which kind of test should be done for you. Apart from that, an ultrasound is done. Generally nowadays people do it, but particularly if you have bleeding issues and all, so it's important to do an ultrasound where they see your uterus, your ovaries, and the reproductive organ, and they find if there is any infection, there is any fibroid, any swelling, for the any thickening of the uterine wall. any collections in the pelvic region, so that's also important. Apart from that, sometimes an external ultrasound, abdominal ultrasound, might not give you clarity. So sometimes transvaginal, yani the probe is put through your vagina and a scan is done, so that gives us more clarity of the cavity inside the uterus. It gives us more clarity about the ovaries. So basically it gives us better structural view, and the radiologist will be able to give you better idea. So please don't hesitate to get a transvaginal scan done if it is suggested. So these are the three organ I wanted to mention, because these three are often missed out. One might do blood test, and blood test might cover various things, but these are the three things which are very, very important. So remember your thyroid, breast, and your uterus, and your reproductive organ, basically uterus, ovary, and cervix. So I hope you find this video useful, and please consult your doctor. Do not hesitate to get investigations done. It's always important we rule out or we find out things at the right time, because for all these things I mentioned, everything has got proper treatment if done at right time. So picking up is the key. So all the best and take care.